Hi, I'm Erin with Body of Light Studio, and in today's lesson we're going to do 2 ball releases for low back pain and SI joint discomfort. Let's take a look at our skeleton. We have our little mini guy here. So SI, sacroiliac joint, sacrum being the bone that connects the 2 pelvic calves at the back of the body, and iliac being the crest of the ilium, where it connects into the sacrum. And the first release that we'll do is a pelvic floor release. So here's the pelvic outlet of the skeleton, and we're gonna put the ball right into the space between the sitting bone and the tailbone. Let's take a look at that in our anatomy book. This one is Anatomy of Movement. And here we have the pelvic floor. So this is an image looking at the pelvic floor from the top down. So this would be the inlet. And here's the pelvic floor closing off the space between pubis at the front, tail at the back, sitting bones on the sides. And then here you have an image of the pelvic diaphragm from up under the pelvis. So there's your tailbone at the back, and here are your 2 sitting bones. And the second release that we'll do is for the piriformis. Piri means pair, formis means shape. And here's an image of the piriformis. So this is the back of the pelvis. Again, you've got the sacrum, the sitting bones, and the piriformis attaches to the greater trochanter, that's the upper outer femur, and the front of the sacrum. Here you have an image of the piriformis. Now we're looking at the pelvis from the pelvic outlet, the bottom of the pelvis. So let's look again at our skeleton. So pelvic inlet at the top, pelvic outlet at the bottom, and the piriformis connects from the front of the sacrum, so it's not the back, but from the front of the sacrum to the greater trochanter. So greater trochanter right here, and the piriformis goes on a diagonal from the front of the sacrum to the greater trochanter. All right, we're going to use a ball, little pinky ball. There's a link in the description if you want to go on Amazon and buy it, and then we'll also use a yoga block. Okay, let's go sit. So we'll begin sitting in virasana or seated on a chair. Whichever position you choose, make sure that the surface is hard, and if you're seated, your feet are flat on the ground. If you're seated on a chair, if you're sitting in virasana, you want to make sure there's no discomfort in your knees, your ankles, or your feet. So virasana, the block is going wide ways underneath your sitting bones, between the feet. The feet are outside of the hips. You can have 2 blocks stacked if you need to be higher, but you do need to be seated on something hard for this to be most effective. We'll take our pinky ball and put it in our pelvic floor. I'm starting with the left side, so the ball is between my left sitting bone and the left side of the tail. So it's just to the right of the left sitting bone and to the left of the tailbone, right in the space of the posterior pelvic floor. Allow your weight to settle down into your sitting bones. Notice if you're squeezing the pelvic floor. See if you can let the tail release back and the sitting bones wide. And take a nice round of breath here. So the inhale, you can visualize it going in through your nose, down the front of your spine. And as you exhale, the breath releases up the front of the spine. So the posterior pelvic floor in many people tends to get really tight for many reasons. It can be because you're not using other muscles habitually. You hold the pelvic floor maybe when you're anxious or stressed out. One of the main reasons that a lot of people resort to this gripping in the posterior pelvic floor is because our anus has a tonic contraction, which is important, otherwise we would all need to wear diapers. But since our body knows how to hold the anus, then we just really go for that and end up gripping there when we're stressed out, or if the rest of our pelvic musculature is out of balance or not really being used optimally. So the pelvic floor, which is the muscle that we're releasing right now, remembering that's that domed muscle that closes off the space between pubic bones, tailbone, and sitting bones. Ideally, as you inhale, it moves down. So you can imagine as you inhale, the pelvic floor spreads out over the surface that you're sitting upon. The pelvic floor releases, it widens, it spreads as you inhale, and as you exhale, it domes up. The pelvic floor engages on your exhale. So just like your respiratory diaphragm, it moves down on the inhale and moves up on the exhale. The respiratory diaphragm engages as it goes down on the inhale. The pelvic floor releases as it goes down on the inhale. And on your exhale, the pelvic floor engages up and the respiratory diaphragm releases up. So we've been sitting here for about a minute. Let's take some rocks forward and back. You can arch the spine and move your pelvis into an anterior tilt. So your tail goes back, your pubic bone drops down. And then as you exhale, you can round the spine, flexing the spine. You're tucking the tail forward and flexing the pelvis. Inhale to extend the pelvis and the spine, kind of like a cow in yoga. And exhale to round, flexing the spine, rocking back on your sitting bones, tipping the tail underneath you. Let's do that 3 more times. Inhale to rock forward, lifting the sternum. Exhale to rock back. Your gaze can move down. Inhale into the cow shape of the spine. Exhaling to cat. Let's do that one more time. Inhale to cow. And exhale to cat. And then come into a neutral spine position. Take the ball out from underneath you and sit for a moment on both sitting bones and feel the difference between your 2 pelvic halves. I always feel a sense of release of all of the musculature of my abdomen move down after doing that. And I also feel really wide in that left pelvic half. Okay, let's do the other side. So now you'll place the ball in the right pelvic floor, posterior pelvic floor. So it's just inside of your right sitting bone, so just to the left of your right sitting bone and to the right of your tailbone, tucked right in the back of your pelvic floor. And notice how this side might be very different from the other side. Maybe you don't sense as much pain or like that intrusive deep tissue sensation. Maybe it's more intense for you on this side. You can close your eyes. Feeling your rib cage widen as you inhale. Allowing the pelvis to settle down into your seat. Sensing the ball moving deeper and deeper and deeper into the tissue of the pelvic floor. Allowing the tail to unfurl behind you, so you're not gripping the tail forward, allowing the sitting bones to widen and spread. You can let your arms rest in your lap. And then we'll start our cat-cow. So you'll take an inhale, you extend the spine, extend the pelvis. You can slide your hands back on your thighs. Lift the gaze. Exhale, tip the tail underneath you, flexing the spine, flexing the pelvis. Inhale into cow. Exhale to cat. Moving slowly, and if you experience any pain, make your movements smaller and even slower. Take 2 more of those. Cow as you inhale, rocking forward on your sitting bones. Exhaling to cat, flexing the spine. Inhaling to cow. And exhale to rock back into a cat. And then you'll stack your spine right in the middle of your pelvis. See if there's any amount more you can settle down into that ball. And then you'll take your ball out from underneath you. Sit for a moment on your hard surface. Feel how grounded your sitting bones are. And then let's come onto our backs. Let me get rid of the ball for now. So you're gonna lie down on your back and we'll put the ball in the piriformis. So the piriformis is that muscle that runs from the front of the sacrum out to the greater trochanter. So you're gonna put the ball, I'm starting with my right side this time. You're gonna put the ball right in the meaty part of your glute. And it may take you a moment to find the spot, but when you get there, there should be like a pretty obvious place where the ball needs to go. It has that like deep tissue massage sensation. And take a few moments to breathe here, allowing the space between your aces, your hip points, to expand. So your breath is moving down to the low belly expands like a balloon as you inhale. And then can you let your pelvis settle down into the ground? So the left pelvic half is completely resting on the ground. You'll be a little off kilter. The right pelvic half is melting over the ball. And you can sway your right knee to the right. Take an inhale as the knee opens. You can fall towards the outer edge, the pinky edge of your right foot. Keep the foot on the ground, but you can roll towards the outer edge of the foot. And then bring the knee back to center. And you'll inhale, the knee sways open to the right, move slowly with control. Exhale, the knee back to center. Feel free to adjust the ball. We are going to do another spot in the same glute, but if you're not feeling anything, then find a better spot. Maybe you need to move the ball higher, lower, wider. And then if you do find a good spot, you can pause with the knee open and just let the leg rest there. Or if the movement feels better to you, you can continue to sway the knee. We'll take 2 more breaths here. Head is heavy on the ground, shoulders resting. Breath moving freely, you're allowing the ribs to expand, the sternum, your breastbone to soften. And then take that ball out and find another spot in that same side that feels necessary to be released. And again, you'll sway the knee open as you inhale and back to center. And then sometimes as I do this, I kind of like roll around a little bit. That's a good option too. You can really do whatever you want. Find some good tender spots on that ball. You can roll around, you can sway the knee, you can lay perfectly still. Wherever you are, whatever you're doing, the breath is long and full. Your bones are heavy. The sternum rises up to the ceiling. It rises up in the direction of your head as you inhale, and it releases down, away from the head, away from the ceiling, into the body as you exhale. And then you'll take that ball out, set it down for a moment, pause on your back, feel the difference between the 2 sides, observe the work you just did. And then we'll do the other side. So you'll put the ball in your left piriformis, right in the meaty part of the glute, and you'll sway the knee to the left as you inhale and exhale back to center. Making sure that you're in a good spot. Feel free to adjust. We will do, again, 2 spots on this side. But if you're not really feeling like the ball is in a spot that's tender, then you need to adjust it to a spot that is. The ribs widen out to the sides of the room as you inhale. They release in towards the midline of the body as you exhale. You can even visualize the movement of your diaphragm here. That'll
help to release the pelvic floor. So as you inhale, the diaphragm moves down. As you exhale, your respiratory diaphragm, it releases up. The respiratory diaphragm flattens and widens as it moves down the inside of the rib cage towards the pelvis on the breath in. And on your exhale, it whooshes up like a parachute, catching the air. It releases up into the rib cage, up into its domed position as you exhale. And then let's find another spot, maybe a little wider, higher, lower. And you'll either continue to sway side to side. Maybe you found a spot you want to stick with and just pause there. Maybe you want to do some movement on this spot, little circles around the ball. Allowing the ribs to expand, the belly to inflate as you inhale. And on the exhale, the abdomen falls towards the spine. A bottomless release as you exhale. On your exhale, the navel falls like it's falling into a bottomless well. Let's take 2 more inhales and exhales here. And then you'll take the ball out, rest on your back. Hands on the ground, palms face up or down, or hands on your body, feet wide, wider than your hips, knees touching so the legs can rest. Now see if as you inhale, you can sense the movement of your pelvic floor. The pelvic floor will release and move down out of the body as you exhale, and as you inhale, the pelvic floor domes up into the pelvis, it engages slightly. And you'll bring your feet together, roll over to your side, come up to sit, and take a standing position. See if you can sense any more freedom in your hips and your pelvis as you walk around. Thanks for joining today. See you soon.